I just want to say this whole episode, if you think that Kegels are the key to a healthy pelvic floor, you may need to think again. Hey everyone, this is Dr. Ellie with our pod I Heal Kids, and I am super excited today because we have Dr. Kerry Tobin with us. In this episode, Dr. Kerry Tobin, who's a pelvic health expert and doctor of physical therapy, as well as owner of Asheville Pelvic Health, yay, here in Asheville, breaks down the myths, the science, and the emotional side of postpartum and pelvic recovery. We're going to explore why pelvic health matters for everyone, not just new moms, and why it affects everything from your core strength to your posture to bladder control, sexual function, and how confident you feel in your own body as well, which I want to hear all about that. So whether you've had a baby or not, you are going to walk away with an understanding of your body in a whole new way. And while caring for your pelvic floor is one of the most empowering things you can do for your long-term health. So welcome. Thank you, Dr. Tobin, for joining us.
Thank you so much for having me.
I just want to start with your journey. So it might seem a bit unusual to some people that you chose pelvic health as your life's work. Do you want to just share about your journey and kind of what drew you to specialize in pelvic floor therapy and also, open your practice here in Asheville?
So, the reason that I started Asheville Pelvic Health specifically, I had been working in insurance based models for the majority of my career and found myself really burnt out and was seeing, sometimes up to 18 patients a day and not feeling like I could give good quality care and
Yes.
also giving good quality care and having the amount of time that I needed with people, as well as being able to assess the whole body. There's a lot of insurance limitations where you can just focus on one area of the body. And so I wanted to be able to treat the body as a whole. And I think that's really needed for pelvic health. I also wanted to be able to give other therapists a place where they can work and not feel burnout and feel like they can give really good care.
Yeah. I mean, I think this is such an important topic. And I'll ask you also, like, what is pelvic health? Because, there's so many people that come, because I'm a pediatrician. So people are obviously coming to me like after their baby is born and all of that. And I have definitely had people just like crying, once they get to know me and they're just crying because they're peeing a little bit. And that's, no one wants that. No, nobody wants that unless you're a baby, then it's fine. But like, we all want to be able to control our bladders to the extent that that it's possible with the bodies that we're given. And so it is so important. And also to your point, for all of y'all that don't know, and I have talked about this so much, insurance-based practice is just kind of crappy. It's just bad for providers. It's bad for patients, in my opinion. I don't think it's really good for anybody except for maybe the insurance company because there is nothing that my first job, I was seeing I would have 25 people on my calendar when I walked in the morning. And then I would be double, triple booked because the practice was trying to make money, right? And so you're trying to see 3 people in a 15-minute slot. If you think you can get great quality healthcare that way, it's really hard. It is really hard. So, and there are great providers and great doctors that are just stuck in those lousy systems. And, I'm here and it sounds like Dr. Tobin is also here to just revolutionize medicine and bring quality care outside that insurance paradigm. So thank you for that. All right. So for everyone that is like, well, what the heck is pelvic health? What is it?
Yeah, absolutely. Pelvic health is really anything having to do with the pelvic floor, which are the muscles at the bottom of the pelvis, and all of the structures around that. So I like to think of, if we want to make it kind of simple, we can get into the 5 Ps.
So, when we talk about the 5 Ps of pelvic health, we think first about pain. So, that could be pain anywhere in the pelvis. It could be vaginal pain, vulvar pain, pain with sex, penile pain, testicular pain, tailbone pain, pubic bone pain, anywhere in, sometimes we'll say nipples to knees, in that general area, should not be experiencing pain. And that's something that we can make a big difference with. Second, we think about peeing. So issues with leakage are the things that people usually think about, but we can also help with urgency, frequency, interstitial cystitis, difficulty emptying completely, pain with urination, all the kind of urinary things. Also, bowel health. So pooping, the third P. So constipation, difficulty emptying there, difficulty controlling gas or stool, um, pain with bowel movements can also be something that we can help with in that area. Pleasure would be the fourth P. So making sure that not only is sex not painful, but also that it is pleasurable and we're able to achieve orgasm. And the fifth P is prolapse. So making sure that we have the support for the pelvic organs and that we're not getting those symptoms of heaviness or falling out or bulging sensation too.
Okay, I love that. Okay, so pain, peeing, pooping, pleasure, and prolapse. Those are the
Mhm,
5 things. Okay,
mhm.
that's really good. Because I do remember, I mean, this is dating me, but, like, when I was, like, first starting, like, 18 years ago, I remember there was this elder who I was doing a family medicine rotation. Oh my gosh, it must have been 20 years ago because that was in yeah, that was in medical school. And she had one of those is it a pessary or pastry? I don't know how you say it, but it's like this,
Pessary,
like,
yeah.
device that, like, holds everything kinda up and in, and I was blown away. I was like, "Oh my goodness." So it sounds like hopefully we can work to avoid something like that or, like, help people with that kinda issue too. Also, interstitial cystitis for people that don't know, basically painful bladder, pain with sex, you're having urgency, you're peeing, like, a lot every day, it's very uncomfortable, so that is interstitial cystitis. So I wanna talk about so I love the 5 Ps, and I also wanna talk about, like, Kegels, because this is, like, something that comes up all the freaking time. Like, anytime anyone mentions pelvic health, it's like, "Well, you gotta do those Kegels," and it's like, you're in your car, you're squeezing everything together, you're like, "Okay, I did my Kegels." Can you walk us through, like, why it may not be the best for everyone and, like, when to do them, when not to do them, and all of that? Because I know people are dying to know.
Oh, I'm so glad you asked this because I think that's all that people really know about the pelvic floor is they've heard of Kegels and then that is kind of the limit of it. So, I like to use the analogy or think of the pelvic floor as like a house. So if we think of the ground level of the house as being like normal, relaxed, where we should just be kind of hanging out during the day, we should be able to contract up to level 1, level 2, level 3, level 4, like up to the attic of the house. And that's kind of what a Kegel is, and being able to engage all of that way. Then we also
Okay.
need to be able to relax back down to resting. And then we also need to be able to go down to the basement or that expansion downwards. And so many of the people that I see are stuck up at like level 1, level 2, level 3, and they're like, I don't even know how to come down to ground level. So if we have those people start doing Kegels and we're going from level 2, level 3 up to the attic, and then we're never
Yeah.
coming down, we end up with a lot more dysfunction
Okay.
than is helpful.
Okay, and so is that because people can't, like, relax enough to, like, go to the bathroom or, like, experience pleasurable sex? Is that what's going on with that? Or, like, why would that be?
Why would it be that they'd be like up in that level
Why would
2,
it be,
level
like,
3 place?
problematic? Yeah, like, why would it be a problem to be, like, kind of tight and, like, elevated like that?
Yeah, right. Because 'cause you're like, "Oh, that would be helpful," but I like
Yeah,
to
like,
kind
you're
of think of
stronger, right?
yes, and that's really important to know the difference between tension and strength because they're not the same thing. So,
Okay.
I like to use the example of, like, if I hold my arm in a flexed place and I'm holding it there all day long and then I try to lift something, I'm not gonna be very effective, versus if I can relax all the way and then be ready to lift something, I'm gonna be able to be a lot more effective in that way. So, we can think of the pelvic floor very similarly. So, like, if it's in that tense place all day long and then you go to cough or you go to jump and it's like, I don't know how to handle this pressure from above, and it then you have leakage.
Okay.
And or that tension can also really create pain, difficulty emptying, pain with sex, the whole all
Okay.
of the diagnoses that we just talked about.
Okay. So like the body's carrying this excess tension. It's hard to go to the bathroom. It's hard to handle additional pressure. So basically, it just causes a whole host of problems. You might be actually making it worse doing those Kegels, which is why someone should come see someone like you. Which brings me to my next question. So, like, when do people know, like, okay, I need to go see a pelvic physical or occupational therapist? Like, how do I know? Like, are there signs, milestones? We talked about the pee and the poop and everything, but it's like, what are like the very specific, like, things that people are like, I have this, I need to go? Or is it something that people could kind of maybe do some stuff at home?
Really good question. I think it should start to be more proactive care just for everyone. Like, you know how we go to the dentist twice a year? Like, I really feel like we should have our pelvic floors checked twice a year because they're changing throughout our lifespan.
Yeah.
And there's different stresses on them, whether it be you're heading into childbearing years or now you're heading into perimenopause or and things are changing in the body constantly. So to have that sense of like, oh, what's happening in my body and get that idea can be so helpful. And I think that there are other things to kind of look out for that are kind of like we're in red flag territory. Like definitely need help, whether that's any of the 5 Ps that we talked about. So leakage, pain,
Okay.
um, difficulty with bowel, bladder, those kinds of
Yeah. So
things.
not just like don't wait for an emergency, basically. Like come in for
Totally.
your routine care. Like it is okay. Everyone needs it. That's very interesting because I think most of us kind of think about like, oh yeah, like I had a baby, like maybe some pelvic floor or something like that. Like that would be kind of what most people would think of, I imagine, or like, having incontinence and things like that. But I had not thought about perimenopause and menopause, and that is, like, a great point because to your point, there are so many changes that happen with, like, vaginal dryness and pain with sex and, like, so many things that people have issues with, and I feel like, in the work that I do with parents and grandparents, because that's how it kinda goes, I get a
Hmm.
lot of questions about that, and I do a lot of functional medicine to help try and alleviate some of those symptoms, but I feel like with the synergy of pelvic health and with functional medicine together, it might be possible to even like get deeper and go further with that type of work. Can you say more about like perimenopause and menopause and pelvic health?
Yeah, absolutely. I think there's obviously the hormonal changes, which is why I get so excited about your work because if we can get the hormones back online, especially
Yeah.
during and correlated during that time. But then also we need coordination and tissue health in that area. And if the pelvic floor isn't moving like it should, and we don't get that blood flow, we don't get that lymph flow, we don't get that movement of the tissue, then it's just kind of like anywhere else in the body. Like it's just what is it that saying of like you don't move it, you lose it kind of a
Oh
thing.
yeah, use it
Um,
or lose it. Use it or
Yes,
lose
there you
it.
go.
Exactly. You
Which
heard it here, y'all.
I think is really applicable to pelvic floor and so helping folks to oftentimes just get back in touch with this area of their body and experience whether it's neutral to positive sensation, but we never want to have negative sensation in this area. And so retraining the body to be able to feel pleasure and feel um, sensation in this area without guarding. I think so much there is the guarding when we get to the place where the tissue isn't maybe the most estrogenized and it's more sensitive. And so then there's this
Mhm.
fear and then they're really living up in the attic all the time. And so it's helping the musculoskeletal system to act in the way that it
Relax.
needs to.
Oh, act, yeah. I feel like, I don't know if this is true, and you can tell me if I'm totally wrong, but I feel like some of those somatic bodywork practices might be really helpful, like breathing and meditation and things like that. Is that true?
Oh, totally. We spend
Okay.
so much time here going through helping people get back in touch with feeling their body and noticing the sensations. So, for example, anytime you're clenching your butt muscles or clenching your belly muscles, there's direct connections between those and the pelvic floor. So, the pelvic floor is going to be tense too. And so many of us walk around all day with our butts clenched and our gut, belly tense. And so just starting to notice those things and then trying to figure out like, oh, when is it when I'm holding that tension? Is it every time I'm doing dishes, my butt is clenched? Or is it when I'm around this person in my life, my body's always clenched? Okay, now we can start working with that and helping break those patterns down.
Okay, so no booty clenching outside of your workouts, which I know that my friend Lizzie Ma, who has an amazing, I'm going to link it because she's amazing. She has a great workout class. In her class, she's like, listen, you have got to engage your core and your booty and all of that for strength. So I'm guessing that's good for a minute, but we don't want to be doing that all day long. So no booty clenching outside of your workout class, basically, right? Okay.
Yeah, and even then, like, yes, there's parts of the workout that it probably needs to be you're trying to intentionally turn it on, but a lot of times it can be overworking, and then it's getting that balance between the pelvic floor and the glutes and the abs so that we also are managing the pressures within the abdomen too.
Okay. Okay. So it's kind of a balance. It's not like,
Yeah.
okay. So
Mhm.
I feel like this could be like maybe an intimidating thing to come to get care for
Mhm.
because I mean, let's be honest, it's a sensitive area of the body. Like, I don't even love, no offense, OBGYNs, but I don't even love going for that kind of care. And now we're talking about like coming more regularly for help with a sensitive area of the body. So, like, how can people know that they're getting good pelvic care and comprehensive compassionate care and like nothing shady's going on? Because I think that could be a big concern.
Mhm. Really, I like to name that I think the best way to assess the pelvic floor is internally. So that can be intravaginally, interrectally, and we have lots of other options. So if someone isn't comfortable with internal work, we can assess the pelvic floor externally. We can assess it through clothes. It's just not quite as effective as assessing internally, but we like to be really mindful of if somebody's had a history of trauma or they're
Hmm.
just not ready. There's a lot of people who come in there, they have had medical trauma or they are just not ready to go there. And so then there's a lot of things that we can look at externally first. But I think being with a therapist who is educated and knows how to do internal work is really important. There's a lot of therapists out there who say they do pelvic therapy, but they don't do internal work. So they are missing a whole piece of the puzzle. And
Yeah.
then I think also the quality of care, another thing that's really important for the quality of care is being with somebody who does take the whole body into account. So we need to figure out, why is the pelvic floor either in that tense place or maybe it's stuck in the basement and it can't even get up to ground level. And maybe it's only doing that on the right side or it's only doing that on the left side. And then we need to put together, like, why is that happening, and do the detective work to get to the root cause of it. And there's a lot of pelvic therapists who will just spot treat the pelvic floor and do some massage work. And they're like, you're good to go. And then it's just going to come back. And so we really need to
Okay.
figure out those underlying reasons why the pelvic floor is doing what it's doing.
So it's kind of like assessing, if I'm understanding correctly, and correct me if I'm wrong, it's like assessing what's causing like the repeated patterns of restriction in the body versus just kind of like loosening things up and calling it good.
Yes, totally. So, for
Okay.
example, like it might be that the right side of the pelvic floor is holding a lot of tension and can't work for you the way that it needs to, and that's causing leakage, let's say. And that might be happening because you have plantar fasciitis on that side and you don't have stability going down your leg. And so it's it's putting those pieces together of like, okay, we're going to get that foot stronger and we're going to get the hip stronger, and then we can that'll let your pelvic floor start to chill out.
I mean, that
That
is
makes sense.
fascinating, Carrie. Like, who would have thought, like, oh my gosh, this like inflammation, tension in your foot is causing possibly bladder leakage? Like, that is blowing, like, literally blowing my mind right now, like, I'm like, "Oh my gosh, I need to check my feet and get my roller ball out and schedule with Carrie because, like, I'm in a little bit perimenopause right now." So I'm, like, checking off. That is wild. So, okay, so not just the pelvic floor. Also, if you're not comfortable, because listen, we just met and you haven't taken me out to dinner yet, we can do some outside assessment first and then build a relationship, see how we feel. That is great
Mhm,
to hear because I think some people might be like waiting because they're really scared or really
mhm,
intimidated. Like I would be nervous and I'm a freaking doctor.
mhm,
I'd be like, I don't know what to
mhm,
expect. Like, I don't know this person. What if it's, someone who's a little bit weird or creepy or something, you know?
mhm.
So on that, like, I'm going to get a little explicit here because I just feel like people need to know. Like, if you're doing an internal exam, like, is that like, are you using like fingers, specula? Like, what is happening?
Ooh, I
Let's
love this.
just
Thank you.
rip the, yeah, let's just rip the blinders off so people know what's up.
Absolutely.
Yeah.
So we used um, gloves, fingers. We can feel from the outside first, so we can assess each individual muscle from the outside
Hmm.
and feel if they're holding tension, if they're tender, if that's bothering you at all. And then inserting a lubricated finger vaginally, I can feel onto each individual muscle of the pelvic floor and check its tone, check its strength, see if that reproduces symptoms like pain or urgency. And then based on what we find, we can go from there. But a lot of times that's really slow. Like I talked through that really fast just now, but that we talk you through each step of the way and explaining like how is this relating to your symptoms and back up. We always start every session by saying you are 100% in control. So if something doesn't feel right or you want to back off, like nothing should be painful. And we work together to kind of create that plan and go from there. Because yes, it's a really sensitive issue, and this area does also hold a lot of emotion
Hmm.
and is really tied with the autonomic nervous system, and so we need to be really sensitive as we're assessing it and treating it.
Okay. So, assuming that you go to someone who's talking you through every step, they're taking proper precautions, wearing gloves, they're letting you know like you're totally in control. That's all normal. But if anyone is doing anything that you feel like you can't say no to or feels outside of that box, then you might want to hit the door. Yeah? Okay. All
Yes,
right.
100%.
Got it. Okay, got it.
Mhm.
And so, okay, so I imagine there's like a million misconceptions about pelvic health and treatments. Do you want to just clear some of those up?
Mm. Yeah, gosh, I think the one that we touched on already with Kegels is huge. So
Yes.
really understanding that the pelvic floor isn't just meant to contract, contract, contract. It needs to relax all the way, and it needs to be able to go through that full range of motion. And it's also, I always kind of say it's kind of like I volunteer as tribute for anything else that's not doing its job. So we really need to put together all of those pieces around as well. I think
Okay.
another uh, maybe common misconception that I really like talking about a lot is that we need to be using our ab muscles. So for so long, we told people to not do things like crunches, especially like when you're pregnant or, to avoid diastasis or to avoid prolapse. And now we really know how important that is. And making sure that we can be using the ab muscles in conjunction with pelvic floor.
Okay. So, like, if you're
So
pregnant, do some crunch. Like, how's that working? Like, what trimester? Because I'm thinking we've got some belly at the end there. Like, when are we supposed to be doing all that?
yeah, uh, I would say from very early on. So even I would love if everyone would come to us pre-conception because then we could
Me
really look at
too.
these patterns.
Yes. Come preconception. I want to detox you. Okay. I'm here to say.
Yes.
All right.
Yes. Oh,
Okay.
I
All
love
right.
that.
Sorry. I just had to get that in there. Go ahead.
um, but the research is pretty strong that we need to be doing it throughout all 3 trimesters. And into postpartum too, as long as we're not getting pressures down into the pelvic floor, but and that's something that we could check for. Uh, but the benefits definitely outweigh any risks the research is pretty solid on right now.
Okay, and I'm assuming you can help women, like, learn how to do that properly and safely so they're not confused and are like, "Well, I don't know, like, I've got this belly situation." Okay, good. We'll send them to you.
Absolutely.
So I feel like we touched a little bit on the orthopedic manual therapy, just a bit with, like, the foot and everything. Do you want to say more about that? Because how does that? Because 'cause you're certified in orthopedic manual therapies, like, how does that play into everything? What is that exactly, and how does that help your work with, your clients?
Yeah. So manual therapy is any kind of hands on work that helps I think what we're really affecting is the nervous system. So we're helping the body to really feel safe and help the tissues to whether it be soften or move better. And then we follow that up with new movement or exercises to help the body stay in that new pattern. So, for example, let's say the pelvic floor is really tense on, let's say the front, the anterior, the front part of the pelvic floor is really tense. And we can do some really gentle work of like compressing the tissues around there to help the pelvic floor to start to relax. And I think starting with that relaxation and helping the body feel safe, and then following it up with whatever was possibly causing that tension. So that might be um, adjusting the way that the pelvis is positioned, or possibly changing the gripping in someone's belly, or breathing postures, and possibly their ribs are expanded too much, or not enough on one side or the other. And so then sending them home with those patternings. But I think if we just send people home with exercises without first helping the body to start to feel what we're doing, isn't as effective, and can be really challenging. So
Yeah.
I think manual therapy is a really beautiful way to help the body adapt and feel, and then follow it up with helping people feel empowered to be able to do it on their own.
Okay, perfect. So it's kind of like looking at the body in a holistic way and not just focusing on the pelvis itself. Yeah?
Mhm.
Okay. So I want to talk about like if probably this might be sensitive for some people or could be uncomfortable to talk about, but like what about partners, families? Like how can people support people with pelvic pain? Because I imagine that there might be a little bit of taboo about it, or like if you're uncomfortable during sex, maybe you don't want to say to your partner, especially if you just met them, which
Mhm.
everyone should be married because this isn't I Heal Kids. But let's be honest, there are things that happen that people are shy to talk about, or maybe they're having incontinence. Like, how can somebody, support someone having these issues so they don't feel so alone and like it's only them? Because it's certainly not. It's really not. And, postpartum too. It's so hard.
Mhm. I think the more that we have conversations like this is the first step in that. The more that we can help people to feel confident talking about it in general, is so helpful. So the more we can not have it be taboo, like these issues are all around us. And it's not like if you have a knee issue, people are always like, oh yeah, I'm going to PT for my knee. Like nobody's like, oh yeah, I'm going to PT for my leakage
No.
today or my pain with sex. So the more that we can start to
Yeah.
talk about it, then I think people won't feel alone. So as a partner, I think being open to having those conversations and just keeping those open lines of communication is really, really helpful. And then I guess depending on what exactly is going on. So maybe if we focus on the pain with sex aspect of things, a lot of times we will kind of take intercourse off the table for a little bit because we want the body to feel really confident when we head back into it. And so it might look like a lot of support around that and creativity on how can we still create intimacy, and how can we create connection and help people feel um, positive sensations still in a physical way without going to that painful place yet, and being really supportive around that as we're doing that. And I think that's a beautiful thing to think about in postpartum too. There's a lot of other ways to create intimacy that's not just intercourse.
Yeah. Yeah. Because I think that a lot of people maybe don't think of it as the same way as like having an injured knee. It's like if you injured your knee, you probably wouldn't go do like 12 jump shots like right away.
Yes,
But
totally.
yeah, but if you have an injured vagina or penis or, bladder, whatever, like then you're all like, okay, well, I'm just going to go have intercourse. Like that might be painful. And like you might need a rest, I would imagine, for a little while and get everything to relax and get kind of recovered. So that makes sense
Mhm.
to me. So maybe just having some sensitivity and support around that. And to your point, learning how to create intimacy and romance and connection outside of that. I think
Mhm.
that's great. That is like honestly, and also like, okay, I just want to make sure I ask this question because I feel like I'm going to forget. Postpartum specifically. So I kind of feel like anyone who's ever been pregnant needs pelvic floor. That said, like with that mindset, I mean, first of all, do you agree with that? And second of all, if so, like when should people come and see you once they've delivered? Because I know like the first month, it's like, okay,
Yeah.
what do you think?
We usually see folks at about 2 weeks postpartum over telehealth.
Okay.
And we're doing a check-in at that point because it's really hard for them to get out of their homes at that point. And so
Yes.
we're just doing a check-in of what's happened, how was your birth, how are you feeling, what are your issues that you're having, and how can we help you troubleshoot them. I think in an ideal world, that would look like touching base with people even in the hospital. There's some places out like Duke does this. They have physical therapists go in the hospital right after birth. And then even in other countries, you can't leave the hospital until you see a pelvic PT after birth. So I haven't found a way to logistically make that work yet here, but I think 2 weeks is when we typically will start to just see what's happening. If somebody's suffering or in pain in any way, we get them in as soon as possible. So there's no reason to wait. Like if you're having back pain, if you're having debilitating tailbone pain, hemorrhoids, all of those things, we can work on sooner. And then as far as doing internal work after a vaginal birth, we usually wait till about 6 to 8 weeks. And then after cesarean, we'd wait till around 12 weeks post-birth. So those are kind of the markers that we think of as far as doing internal work and when we'd first want to see someone specifically for that. But around other issues, we can absolutely see people sooner.
Okay. So I need to start referring my new mamas when they've delivered so that they can get in with you ready for their 2-week checkup or depending on like where they're at with things for their post vaginal birth or post C-section birth checkups too.
I would even refer sooner. Like most ideal, I know we talked about preconception, but at least like second trimester, because we
Okay.
can do a lot of things to prep for birth, which can really help prevent issues in the postpartum time. So we're looking at, does the pelvic floor have that mobility? Can it relax and expand to let baby out? Can the bones of the pelvis move to let baby position well and make their way through the pelvis? Can the tailbone move to let the baby come out? And all of these things that a lot of times will stall labors or then require more interventions. If we can get ahead of it and have that awareness in the body prior to birth, we see a lot better outcomes and then easier recoveries in postpartum.
Okay, perfect. So you heard it here, y'all. If y'all are one of my pregnant mamas, you need to go see Dr. Tobin like today. Okay. And I will try and remind you in clinic if you are pregnant and I'm already seeing you for another kid. And then my OBGYN friends, doulas, midwives, we got to send to Kerry too. Okay. All right. I love all of that. I wish we had time to talk about men's health too, but we just don't. So maybe we'll have to do another episode on that. But where can people find you? Where is Asheville Pelvic Health? How can they connect with you and learn more?
Yeah, we are on Charlotte Street. So you are always welcome to come stop by, and we have a welcoming waiting room where you can just pop in and chat. But you are also welcome to find us on Instagram and Facebook. We are at Asheville Pelvic Health. You can text or call us as well. Our patient care coordinators are really excited to talk to people about what's going on with their bodies and help troubleshoot and find the care that you need. So please feel free to text or call us anytime, and we can help you troubleshoot through what's happening for you.
Oh my gosh, I love this so much. Thank you so much because
Thank you.
we just do not talk about this issue enough. And I really wanted to do it because even though my pod is I Heal Kids, I have so many women that are listening that have delivered or are about to deliver or experiencing these problems. And we need to be able to support each other and get past all of that stigma and like weirdness because pelvic health is part of the body and we have to check it. So thank you so much for joining us today. And my name is Dr. Ellie. My practice is Middle Path Integrative Pediatrics. I'm in Asheville, North Carolina, and you can find me on Hendersonville Road, Instagram, Facebook, and all the fun places. Please like, subscribe, all the fun stuff. All right. Wishing you well. Bye.